Nagabenta ki khubor baman kasni pet but subscribe ya u Antor News. Hublai phi baro kinikilong ki khubor bam takasi. Ka Meghalaya AIDS Control Society ka pante pakan saraki ka International Youth Day 2024 haga khat artrik August 2024 ha Soso Tham Auditorium. Habakran Shakilat Pathai Khubor haga khandai trik unailar 2024 ha Shillong Press Club ka Dr. B.D. Cruz ka badai ka Project Director Meghalaya AIDS Control Society Shillong kala ong bahaba shimjinghen kalum bontam ka is jantia kinong pang HIV. Kathimenta usnem kadai from clicks to progress, youth digital pathways for sustainable development.
Injecting drug users can. Kita injecting drug users. Tidak kini IHO ki batray na matakta. Tidak kami IHOs ki batray. Tidak kini ki substitution therapy sectors. Kini IDU belong to active clients doing work kini di centers kita aja sispa aku. Jumlah pada baru hari ini aja sispa aku menjadi HIV positive. They keep injecting drugs and they avail us of a system. Kita boleh kita use gender, was gender district one. They can get prevalence, kabul yang po is gender. Nampak was gender, nampak is cousins. Jadi kita number kita kabul is cousins nama kalau kami ini kita prevalence pada kabul yang is gender. Jadi prevalence district kita is gender, was gender, kabul is cousins.
On promotion, we'll be talking about sexually transmitted infections and other parts of the program. Besides the rally, social media campaign, we'll also be having a special camps at government hospitals. These are all the districts, basically to provide free HIV, STI testing, counseling and treatment services, as well as slum interventions. Of course, in Meghalaya, we still don't have as much slums as comparatively as other cities in India. But looking at the numbers that we have right now, we have about 5 slum areas within Meghalaya. So we'll be targeting these slum populations as well. Besides that, we'll be having 4 performances and flash mobs and all these for these 2 months period. We won't be having the 4 performances and flash mobs for straight 500 villages, but we'll be targeting at the village level as well as semi-urban and urban areas, and schools as well. And besides that, at the village level activity will be collaborating along with the district administration through the office of the videos as well, like to target the villages of these villages that we will be targeting.
Well, I'm Dr. B.D. Cruz, Project Director of Meghalaya AIDS Control Society, and with me are Dr. Laura Murtham. She is a Deputy Director Medical. Shri Ajoy Lamang, Deputy Director who's looking after IEC and mainstreaming. Shri John Rajri, Deputy Director of Lab Service. Shrimati Larina Nampur, Assistant Director for Youth. Shri Rapora Mani, Assistant Director for IEC. And Shri Kiran Patrus, the Store Officer. So this press conference is called today to provide comprehensive information to you about the intensified IEC campaign organized by the National AIDS Control Organization. It will be launched on the 12th of August on the occasion of the International Youth Day. The launch will take place across the country, in all the states and union territories through state AIDS control societies. And the campaign will continue for 2 months. The main objectives of this campaign are: number 1, to enhance knowledge and understanding of HIV and STI among the general population, and number 2, to promote safe practices, reduce stigma and create demand for HIV STI services among the general population. There will be different activities at the national level, at the state level, at the district level, and also at the village level. At the state level, Meghalaya AIDS Control Society will launch this campaign on the 12th of August at Soso Auditorium at 11 a.m., where our Honorable Minister of Health and Family Welfare, Dr. Maisel Anthony Lingua, will grace the occasion as a chief guest, besides other dignitaries. The Government of India has been implementing the National AIDS Control Program by providing the HIV/AIDS prevention, testing and treatment services and aim at ending this HIV/AIDS as a public health threat by 2030. Although HIV prevalence in the country is at low prevalence, which is at 0.21%, but there are 25.44 lakh people living with HIV in the country, and 18.06 lakhs are on treatment, that is on ART treatment. New HIV infection in the country this last year, that is to 23 to 24, is 68,450, coming closer in our state. Our adult HIV prevalence is higher than the national average, that is at 0.42%. Number of people living with HIV as of June 2024 is 9,130. Started on treatment, that is on ART, are 8,354. Those who are alive and on treatment are 6,250. And the new HIV infection for the year, that is for 2023 to 24, is 1,524. So these figures underscores the urgent need for intensified efforts to combat the HIV/AIDS epidemic. In order to enhance the knowledge levels of the general population, especially youth, and equip masses with correct information about HIV/AIDS across the state, and to ensure the success of the campaign, I request all of you to provide support by your active participation and media coverage throughout the duration of this campaign. For detailed information and the different activities to be carried out in the state, I will request Shri Ajoy Nano, our Deputy Director looking after IEC and streaming, to address.